Welcome to the deep dive. Today we're tackling hyperbaric medicine, a fascinating field where practices really shift depending on, well, where you are in the world.
Exactly.
We've gathered a range of information to explore these international differences, giving you a snapshot of how this therapy is applied globally by looking at some key examples.
That's right. And we're not trying to cover every single country, obviously, but instead focusing on some revealing cases drawn from our research.
Which comes from?
Specifically, a chapter offering a worldwide overview of hyperbaric medicine. It highlights trends and the distribution of facilities.
Okay.
And we'll be using China, Japan, Russia, and Germany as our main lenses today. So kind of a perspective beyond the U.S. and Latin America, which are discussed elsewhere in our source material.
Got it. So the aim of this deep dive is really to understand the diverse approaches to hyperbaric medicine internationally.
Yeah, get a sense of how widely it's used in different places.
And maybe what kind of research is happening too. Okay, let's unpack this. Maybe starting with China. It sounds like there's been remarkable growth there.
Oh, definitely. What's particularly striking about China is the speed of development, especially after the Cultural Revolution. The scale now is, well, truly impressive.
How impressive.
We're talking about over 5,000 hyperbaric chambers currently in operation across the country.
Wow, over 5,000 chambers. That's a considerable infrastructure.
Yeah.
What does the support system look like for something that big?
Well, the research points to a substantial workforce exceeding 35,000 individuals.
35,000.
Yeah, that includes physicians, nurses, technicians, research scientists, the whole team.
Mhm.
And the number of patients getting treatment annually is also pretty noteworthy, over 2.5 million.
2.5 million patients. So it sounds like hyperbaric medicine plays a really significant role in their healthcare system.
It certainly paints a picture of widespread use, yeah.
And it's not just about the sort of standard treatments there, is it? The research side sounds quite dynamic too.
Indeed. Beyond the, let's say, conventional applications, Chinese researchers are actively exploring HBO for a really broad spectrum of conditions.
Like what?
Things like stroke recovery, persistent vegetative states, autoimmune disorders, even cancer treatment, and looking at preventing organ transplant rejection.
That's quite a range.
It is. This proactive research agenda kind of hints at a potential future where China might play a leading role in expanding the recognized uses of hyperbaric medicine worldwide.
And it sounds like they've also put a strong emphasis on standardizing how it's all applied, making sure everyone's on the same page.
That's a critical aspect, yes. The Chinese Professional Committee of Hyperbaric Oxygen has really taken the lead in developing and, importantly, revising guidelines.
Guidelines for what works and what doesn't.
Exactly. Indications and contraindications.
Yeah.
They established standards back in 1982, then revised them in 2004 and 2013. And it seems the 2004 version is the one that's most widely used in their clinical practice right now.
That commitment to standardization must be crucial, especially with such rapid expansion.
Absolutely. It's essential for patient safety and, making sure treatments are effective as the field grows so quickly.
It really gives you a sense of a field that's not only growing fast, but also actively trying to establish best practices. And the volume of research coming out of China, it's quite significant, isn't it?
It really is. By mid-2016, there were something like 15,000 articles related to hyperbaric oxygen in China in various databases.
15,000?
Yeah, and nearly 400 of those were indexed in PubMed, which usually indicates a certain level of scientific rigor.
So it underscores that HBOT therapy in China is definitely a continuously evolving and actively investigated area.
Absolutely, no question.
All right, let's shift our focus now. Maybe travel east to Japan. Their engagement with hyperbaric medicine seems to have, well, different roots.
That's correct. Before World War I, the main interest in Japan wasn't really clinical. It was more about the physiological effects of diving.
Diving?
Yeah, particularly related to AMA divers, those remarkable free divers, and also the health of caisson workers in industrial settings, underwater construction and things like that.
Right, the bends and pressure issues.
Exactly. Clinical applications really started emerging in the 1960s. There was notable work at Tokyo and Nagoya universities.
Okay.
And interestingly, Nagoya University installed what was, at the time, considered the largest hyperbaric chamber in the world.
The world's largest chamber back then. That shows a pretty significant early commitment to exploring this field.
It does.
Yeah.
And I imagine that really helped them explore various potential clinical uses for hyperbaric oxygen therapy.
Makes sense.
And a key milestone was setting up the Japanese Society for Hyperbaric Medicine, the JSHM, back in 1969.
Ah, the professional body.
Yes. And they've been crucial in education, offering training courses for nurses, engineers, and also in spreading knowledge through their journal, the Japanese Journal of Hyperbaric Medicine.
So they've built a pretty robust professional framework around it. What about the number of facilities now and the types of chambers they use? Is it similar to China?
Well, as of 2015, Japan had roughly 820 hyperbaric chambers,
820. Okay.
located within about 620 medical facilities. But what's really notable here is the very high proportion of monoplace chambers.
Monoplace. So just for one person at a time?
That's right. Around 93% were monoplace, though they are installing more multiplace chambers now, the kind that can treat several people at once, often with staff inside.
Where are those going in?
Particularly in university hospitals, it seems. So I might suggest a bit of a shift towards facilities maybe capable of handling more complex cases or just higher patient volumes.
Interesting. It sounds like their approach has historically been very focused on the clinical side, just using it. Is that still the main emphasis?
You're right, the historical emphasis was strongly clinical application. But there's definitely a growing recognition now of the importance of more sort of fundamental research.
To back up the uses.
Exactly, to provide a stronger scientific basis for why it works for current uses, and maybe find new ones. One area getting significant interest is combining hyperbaric medicine with oncology for cancer therapy.
Ah, okay. Exploring new frontiers there.
Yeah, reflecting a desire to explore novel therapeutic strategies involving HBO.
And they do have a defined set of conditions where HBO is accepted currently, right? A specific list.
Yes, the JSHM has established a clear list. They categorize them as either emergency or non-emergency.
Okay, examples.
Well, emergency ones include things like acute carbon monoxide poisoning, gas gangrene, air embolism, severe burns, kind of the classic emergency indications you might expect.
Right.
For non-emergency situations, they list things like malignant neoplasms when used alongside radiation or chemo, peripheral circulatory disorders that have stubborn ulcers, and some other specific conditions. It feels like a more clearly defined, maybe somewhat more conservative list compared to some other places we'll discuss.
Okay, definitely noted. Right, let's turn our attention now to Russia. Our information suggests they have a very extensive network of hyperbaric facilities there.
Indeed. Russia reports having over 60 specialized centers equipped with around 1,400 hyperbaric chambers in use.
1,400 chambers. That's, again, a very substantial infrastructure.
It is.
And the conditions, the indications for HBO therapy in Russia, they seem to cover a much broader range compared to, say, what's typically approved in the United States.
That's a really key point, yeah. The scope in Russia is considerably wider.
Why is that, do you think? Different regulations, different priorities, maybe just different interpretations of the science?
It could be a combination of all those things.
Yeah.
But the result is that it's applied across this vast array of medical specialties. I mean, listen to this list. Cardiology, pulmonology, gastroenterology, hepatology, nephrology, hematology, oncology, endocrinology.
Wow, keep going.
Rheumatology, allergology and immunology, infectious disease, emergency medicine, diving medicine, general surgery, orthopedics, thermal injuries, neurology, neurosurgery, OBGYN, neonatology, pediatrics, ENT, toxicology, ophthalmology, urology, and even psychiatry.
Psychiatry. That is remarkably broad. The source mentions over 60 approved indications. Could you give us a few examples just to illustrate how wide-ranging that is?
Sure. Looking at the info we have, some approved indications are things like arterial obstructions, gas embolism, ulcers from circulatory problems.
Yeah.
Those align fairly well with uses elsewhere.
That's our standard amount.
But then you also see indications like heart strain, heart rhythm disturbances, lung abscesses, stomach ulcers, even acute viral hepatitis.
Hepatitis.
Yeah. It really highlights a much more encompassing view of the potential benefits they believe hyperbaric oxygen offers.
It certainly suggests a different philosophy regarding its application. It sounds like in Russia, HBO is just integrated into a much, much wider spectrum of medical treatments.
That's a good way to put it. Integrated into many more specialties and protocols.
Okay. Now, let's shift focus, again, maybe to Europe. Germany is identified in our source as a significant center, particularly for neurological applications.
Yes, and what's particularly interesting about Germany is that historical development in treating neurological issues with hyperbaric medicine.
When was this?
Back in the late 1960s, early 1970s. There was pioneering work at the University Neurosurgical Clinic in Bonn. Professor K.H. Holbach and his team, they explored using HBO for conditions like head injuries and stroke.
It's quite early for that kind of application.
It is. They even looked into using it to help select patients for bypass surgery, though apparently that specific use didn't catch on widely right away.
So early on, a specific focus on these complex neuro cases. And did the research continue in other areas later?
Yes, it did. In the 1980s, there was notable research looking at HBO for inner ear disorders, things like sudden deafness.
Inner ear. Okay.
And then later, studies in rehab clinics examined its potential for patients recovering from chronic stroke. So this sustained interest over decades really suggests a continued belief in its value for neurological conditions in Germany.
And Germany also has a professional organization guiding things, similar to Japan.
Exactly. They have the Gesellschaft für Tauch- und Überdruckmedizin e.V., or GTUM. It's the German Professional Association for Diving and Hyperbaric Medicine.
And what do they do?
They play a crucial role in assessing the scientific evidence for different HBO applications and providing guidance to doctors. Their website also acts as a directory for hyperbaric chambers in Germany, Austria, and Switzerland, which is quite useful.
Right. What about the number of facilities in Germany? Has that grown quickly, like in China?
Interestingly, yes, the growth in Germany has been quite rapid, especially more recently. Back in 1989, there were only 4 active clinical hyperbaric chambers.
Only 4.
Yeah, but by mid-2016, that number had jumped significantly to 30 centers. And these centers offer a range of services: emergency care for diving accidents, 24-hour availability, some with ICU beds. Others focus more on outpatient therapy during limited hours.
And chamber type? We saw Japan prefers monoplace. What about Germany?
That's a key difference. Germany exclusively uses multiplace chambers. Monoplace chambers are currently not approved for use there.
Exclusively multiplace. Why do you think that is?
Well, it likely reflects their emphasis perhaps on those more complex neurological cases we talked about, and maybe the potential need for having medical staff inside the chamber during treatment.
Makes sense. Are they treating a lot of patients?
The volume is considerable, yeah. Over 60,000 patients treated in 2015, and the vast majority, about 85%, were treated as outpatients.
Okay. And are these centers mostly hospital-based or private?
It's a mix. Some are located in university centers with active research programs, but others are private facilities that might have less of a research focus.
And the typical conditions treated in Germany, are they similar to elsewhere in Western Europe, or do they have their own focus?
They do treat many of the generally accepted indications, but Germany shows a particularly high use of HBO therapy for things like tinnitus, acute hearing loss, often linked with tinnitus, noise-induced hearing loss, and acoustic trauma.
Hearing disorders seem prominent then.
Very much so. Other common uses include chronic wounds, diabetic foot ulcers, bone necrosis, radiation damage like cystitis or proctitis, and also Lyme disease-related arthritis. But that strong emphasis on treating hearing issues is quite a distinctive feature in the German context.
Fascinating. So across these 4 nations, China, Japan, Russia, Germany, we're really seeing a wide spectrum of approaches, aren't we? Different scales, different focuses.
Absolutely.
Now, taking a step back, what does the overall global distribution of these facilities look like, broadly speaking?
Well, based on the available data, and our source does caution that these figures might have limitations. They might not be perfectly accurate and often don't specify chamber types.
Sure, caveats understood.
Right. But based on that data, China appeared to have the largest number of hyperbaric chambers worldwide. Then it looks like the USA, then Russia, Japan, and then Europe as a whole region.
Okay, so China leads in sheer numbers.
The numbers of chambers reported, yes. But it's really important to remember that just counting chambers doesn't automatically tell you the number of patients treated or how intensely those chambers are used.
Good point. A few big, busy centers could treat more people than lots of small ones.
Exactly. A country with a few large, high-volume centers might actually treat more patients than one with many smaller, less active facilities. So numbers aren't the whole story.
Understood. So as we sort of wrap up this discussion, what would you say are the main takeaways, the key overarching insights from this global snapshot of hyperbaric medicine?
Well, several key points really stand out. First, China, Russia, and the USA seem to have the highest levels of activity, at least based on the scale of their infrastructure, the number of chambers reported.
Okay, the big players in terms of facilities.
Right. But, crucially, the regulatory frameworks and the accepted conditions for treatment vary massively between them. And with other countries, too.
We certainly saw that.
Yeah. The USA has a generally more regulated and, you could argue, more restricted list of approved indications compared to, say, Russia.
Right.
Japan demonstrates a strong historical foundation in clinical application, but now they're showing this growing investment in fundamental research to back it up.
Okay.
China stands out with just the sheer number of chambers and that very active research agenda, covering both basic science and clinical trials across a wide range.
And Europe?
Within Europe, Germany and Italy seem to be the most active, at least in terms of the number of hyperbaric centers reported. So ultimately, the specific indications for HBO therapy and just the overall stage of its development really differ significantly across these nations.
And that variability in what it's used for, the accepted indications, that really stands out, doesn't it? What's standard in one place might be experimental or just not recognized somewhere else.
Precisely. And that really highlights the ongoing evolution of hyperbaric medicine globally. It shows the different stages of acceptance and development it's reached in various parts of the world.
Well, this deep dive has certainly given us a fascinating glimpse into the diverse landscape of hyperbaric medicine. It really showcases the different scales of practice, the research priorities, and the accepted uses across these key countries outside the Americas.
Absolutely. And, considering these varied approaches and all the ongoing research we've touched on, kind of prompts a thought for you, the listener.
What's that?
Well, what might the future trajectory of hyperbaric medicine actually look like globally? What factors, things like changing regulations, economic pressures, maybe the results of specific research projects, what might shape how it evolves in different regions around the world?
Good question.
Perhaps this exploration will spark your curiosity to dig a bit deeper into some of the specific research areas we mentioned. Or maybe compare the regulatory landscapes of these, well, quite intriguing natural approaches.